Welcome to our 35th Open Mic webinar. And for this week, we're discussing the topic of brain disorder, various neurological condition, and Chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, will present on various topics. Here, I'll share with you a brief overview or summary of what we discussed. I know that most of you or the investor don't like to learn about the science and medicine, but understanding the science and medicine allow you to understand the drug that the company are innovating, and that will give you a solid foundation for grading or evaluating the prospect of a biotech company. When you invest in a biotech stock, it's very important to look beyond the ticker and understand the drug as well as the company that are making this drug and the various conditions that this drug being developed for. In doing so, it's allowed you to pick stock that will become a big winner or alpha. With all that being said, now I'm going to share with you what Dr. Van discussed. So Dr. Van started to discuss about various brain disorder. He went into different classification or type of brain disorder, such as traumatic brain injury, mental health condition, developmental disorder.
And today we're going to talk about the brain disorder. As you know, the brain contains a very important function in our daily life, ability to do several jobs, several activities. So I consider that's the second most important organ beside the heart, of course. The definition, as you can see here, and I want to thank Dr. Miley in preparing the slides and allow us to review the brain disorder that we'll be discussing today. The brain disorders that you see there is any conditions that affect the brain functionalities, the structure, and the chemistry. A type of brain disorders that there are many different types out there, but we want to focus on the most pressing in the news. And for us in biotech, I think the news play a very important role. And the most common being discussed right now is neurodegenerative disorders such as Alzheimer's disease, Parkinson's disease, and then of course mental health disorders, depression, anxiety, bipolar disorders, development disorders such as autism, attention deficit hyperactivity disorder. The seizure disorders also need to be considered, even though it's not being discussed a lot, but there are a significant amount of people in the world being suffer from seizure disorder. Of course, traumatic brain injury is also considered a brain disorder from multiple wars we have all over the world, and including motor vehicle accident as well. And the more common brain injury that we're not aware of or don't think about is brain concussion disorder, being suffered by playing sports or having accidents. As we get older, we're not as functional as we were before, and you can have frequent falls result in brain injury that also compound to the aging process that causing brain disorder as well.
Then shifting gears, Dr. Van started to discuss about the commonly used medication to treat various brain disorder.
Commonly prescribed medications, and you can see some of the lists on here, variety of different medications. Of course, I want to preface this in saying that all these also have side effects as well, so we have to be aware of that when we look at them. Novel pharmacologies, as you can see, a whole host of medications are coming up for us to be considered, and different classes as well. We're going to try to focus on some new medical trends.
For next part of the presentation, Dr. Van discussed the various companies that are innovating solutions in this niche. Dr. Van featured the large cap biotech stock like Eli Lilly, Merck, Biogen, for example, that recently innovated drug to treat Alzheimer's disease, in which the drug is used to remove the plaque in the brain.
Of course, the emerging biotechnology equities. Of course, the most common, as you know, the biotechnology ETF. The more well-known is XBI, but we also have other ETFs also available as well. Of course, regarding company, the most prominent right now is Biogen, which has a collaboration with Eisai, from Japanese pharmaceutical company that developed the first symptomatic treatment for Alzheimer's disease 25 years ago. Lecanemab is an amyloid beta-directed antibody reducing amyloid plaque. It was approved by FDA for using in Alzheimer's disease in January 2023. And of course, follow that, we have Eli Lilly in May come out with donanemab, allow us to treat similarly as well, and it has shown in study to slow progression of cognitive decline by 35% and allow patients to increase independency and halting the progression of Alzheimer's disease by nearly 50% for patients. That medication has been reviewed by the FDA, and we're still waiting for final approval. And of course, we have Merck, which has acquired Caraway Therapeutics, and the reason is because Caraway has the TRPML1, which is an ion channel implicated in the neurodegenerative disease. But Merck also entered into a $1 million collaboration with Ceravance in looking at precision treatments for central nervous system disorders such as dementia, Parkinson disorder, and ALS. Of course, there's AXSM Axum Therapeutic we discussed many times in our meeting, focused on CNS condition. And then, of course, Sage, we also discussed our meeting previously for depression and neurological disorders. And Biohaven, we also discussed for neuropsychiatric treatments, and also mentioned Denali Therapeutic as well to look at therapeutics for neurodegenerative disease, as we mentioned earlier. One company that be interesting for us to also review is Illumina, which develops and manufactures the market's life science tools and integrated software system for research analysis. It's kind of tie all this company together, and I think it's a novel way of looking at biotechnology as well. Of course, the brain is the most important organ according to the brain, but according to a cardiologist myself, I think the heart is still the most important, because without circulation, the brain cannot function.
As you can see, our fund, we focus on investing in young growth biotech companies that are trading at a bargain. No company has a large market cap, which go outside the range of our investing, but it's very important for us to see what the big companies are doing, for us to know how that market is progressing. And then based on that, we would grade the younger company, the growth biotech stock, to see if their drug has a good chance of competing against this giant. If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen. He's a cardiologist, also medical director, and he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector, and in knowing so, I can fine-tune my research position and invest in young innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.